Kachmar. It's Scrubbing Up with Dr. Michael Kachmar.
Yeah, it is.
You like that music?
I'm loving that new music.
You like our music?
Man. Yeah.
We play it a little bit longer.
Yeah.
So
Do the Batusi.
Yeah. All right. So today is November 26th, year of our Lord 2021.
2021.
Yesterday was Thanksgiving. We want to wish everybody a happy post-Thanksgiving.
Yeah, Boxing Day in England, isn't it?
Yeah, this is Black Friday, right, Jeremy?
Black Friday.
So we have Jeremy with his my sidekick. Jeremy, you want to introduce yourself and tell everybody how to get a hold of us and what we're doing and where we're going? And
Sure, everybody knows me. I'm your old pal, Jeremy. I am a director of marketing. I specialize in medical marketing. That's why I'm here. And we do a live podcast every week. It's on YouTube. It's on Audible. It's on Spotify and iTunes, and you name it. Also on, what did I say? Did I say
Twitch?
Twitch,
yeah, but it's like, we're
Facebook,
right, and we
Facebook.
do we do a podcast. So this is published right after this. We have a podcast on Spotify,
Facebook too.
Yeah, Spotify, and so we have a live show right now, and then it's archived on YouTube. So you go to YouTube and see us. You can also go to Spotify or Apple iPods, iCast podcast, excuse me. And you can see us, and you could comment here. How to get a hold of us? Well, who am I? I'm Dr. Michael Kachmar. I'm a board-certified reconstructive foot and ankle surgeon. It's a doctor of podiatric medicine. I operate in multiple hospitals. I do surgery. We put people in the hospital. And we've been doing this for a lot of years. Yeah. Today we're going to talk a little bit. We touch on a lot of things here.
You make people walk again. Right?
Yeah, we make people walk again. So
that's like very biblical. Throw your cane away.
Yeah. I don't know. Listen, I don't know how great I am. I mean, I what I do is this. I really strive to do the best I can. Right. I treat everybody like family members. We're always trying to streamline the practice, and that's a great thing. That's a great thing about Dr. Kachmar. You come in, it's a family feeling when you walk into his practice. It's nothing to be intimidated about, because I know a lot of people get intimidated with doctors, but this is a family atmosphere. Everybody knows everybody, and we try to go by the mantra, cause no harm.
Cause no harm.
And there's a lot of times I refuse to operate on somebody because I don't think I can make him any better. And, and not saying because I don't have the talent, but sometimes, Humpty Dumpty, you can't fix everything. But we try not to, that's our goal. So anyway, Jeremy, can you throw up on the screen, and we'll say it for our podcast, but how do they get a hold of us? There's several ways.
Well, there's several ways. You can go to our website. That's JerseyShoreFootAndLegCenter.com. If you're watching the video portion of our show, you can see it on the screen right now. And our email is,
so that's just to reiterate why he's pulling that. So JerseyShoreFootAndLegCenter.com.
And our email is drkachmar@icloud.com, spelled DRC. Or sorry, I always do that.
Oh my God.
DRKACHMAR at iCloud, ICLOUD.com.
Thank you, Jeremy. Yeah. And we do have a phone number for local people. Is our office. It's 732-269-1133. So Jeremy, let's start the show. Okay.
Yeah.
And we want to talk about today. We're going to talk about the CDC. And let me put this here. We got new cameras today. We have some, more views. This is our studio, and we're getting ready for Christmas. There's our Santa up there. Everybody sees Santa. So we have our Jamesons up there. When we do the lifeguard podcast, the lifeguards who come in here, they have a couple drinks.
They like a bit of the spirits.
Yeah. So what we're going to do today is what we do. We're going to go here and look at the up-to-date. It's called the CDC, Center for Disease Control and Prevention. This is the COVID data tracker at a glance. So this is, pulled it up right now.
So these are all the up-to-date statistics about COVID and what's going on.
Right. So this is this was done yesterday or day before Thanksgiving. So let's just talk about this here. We'll go real quick. So today, this is the United States. Total vaccine doses. How many were delivered, brought to the place of distribution? 572 million.
Hmm.
How many were administered?
Is that to date?
Yes,
Yeah,
that
it's
was
to
Wednesday.
date.
I don't think they did it
Okay.
because yesterday was Thanksgiving.
Yeah.
Administered 454,447,000. So basically, just shy of 455 million.
Mm.
Okay, now and so anybody wants to do this, they could go there and look at this themselves. Now, interestingly enough, right now the cases in the last 30 days is going up to like 47,000. I don't know if that's a day of
Well, I mean,
cases,
if we
but
got 350 million people in the United States, and we've distributed 450
yeah, but you got to get 2 shots.
million.
Remember?
No, I know that, but that's
Right.
that's pretty damn good.
Yeah, I'm gonna break those statistics down. That's what I'm
Yeah.
saying. So if you but the deaths are going down. The deaths of people who are dying from this in the last 30 days is trending down. But we're gonna see. So let's break this numbers down. So here's what they're saying. People fully vaccinated in the United States, 1,096,000,000.2. So 196.2. So almost 200 million. So almost 200 million people.
Yeah, but that's already an outdated statistic, since the CDC just announced that a fully vaccinated person is 3 injections, not just 2.
Well, that's semantics. I understand.
No.
Well, no. Okay. Well, okay. But they added here.
Data.
Okay, but they added here. People received a booster dose. 37 million.
Yeah. See.
Now, what they're not saying here is how many people had corona, and that's our next stage of this conversation.
Right.
So, if you had corona, you do have some level of resistance. Okay. Some people say it's equal. Some people say it's not. But you do have some. Everybody has to admit that. If you have some.
This is the big brouhaha that's happening now in our country.
Right.
When we have states like Florida specifically,
right,
who are trying to take control of their state out of the hands of the government and come up with exception, excuses. If you've had COVID, you should be exempt from the mandates.
Yeah. Well, I'm going to drill down here, but let me just step back. Peter Navarro just came out with a book. It's called In Trump Time. And I think people should read that. But one thing that he talks about in there is when they were going through this, developing, strategy, how to handle this virus, there was several things. One was to close the country down and to, close the country down and to give us some breathing time so we catch up. They made this vaccine, which is not a traditional vaccine. This is new technology. This is a RMA. It's not a attenuated virus. Also, they have therapeutics they're working on. So it's not just one thing. So we right now focus on vaccine, but really it should be vaccine and therapeutics. Okay. And one therapeutic that the CDC really touts about is monoclonal antibodies. The owners, the people who invented the monoclonal antibodies, he says that I watched him on, I don't know if it was 60 Minutes, where he said, if you get the monoclonal antibodies, you got about 6 to 8 months of immunity or resistance. Certainly, if you get a corona first time or a breakthrough with the infection, if you were vaccinated, monoclonal antibodies reduce your chance of hospitalization and death by 75 to 85%.
Yeah.
And that's a CDC, FDA approved drug, and that's their numbers, not mine.
Right.
So you got to understand, this is a whole, so all of this, what does it mean going forward? So I think that, these people who are getting sick right now, a lot, we have a surge. You give them all monoclonal antibodies, they're probably going to be all fine. So let's go back. Let's just keep going here, Jeremy. You make a good point. So now it breaks it down here. So it breaks it down. So here's the fully vaccinated. Okay. So what they're saying right now here is there's the count, fully vaccinated. Now I don't understand, people see they have 2 different numbers here, and I don't want to get into it, but if you look here, they're saying people fully vaccinated, 196 million. People receive booster, 37 million. And then they could put down here fully vaccinated. And this is where your number,
Right.
231 million.
231 million.
Right. So I don't know if they're saying,
so we're 100 million shy.
So Ben, it's now what they say. So, because it gets complicated with these numbers. People could go right now and look at this and try to understand. But right now, what they're saying is, and I know it sounds like two different numbers, but 231 million people are fully vaccinated in the United States. That represents 69.7, basically 70% of the population.
Right.
Are fully vaccinated in the United States. Now, normally that would indicate herd immunity,
right?
Which means it's that's another concept I can't get into right now. But so now here's the intro. This is by population age. This is really interesting now. Population older, greater than, equal to, or greater than 5 years of age. Okay, how many people in that age group from 5 and above? 74% of the population. That represents the vast. That's all the same. That's the same number, pretty much everybody. Okay.
Yeah.
Population 12 and above. Okay, 12 and above. 80% of the population, 227. People 18 above, 82%. Now listen to this statistic. This is great.
Yeah.
People 65 and older, 65 years and what percentage of the population of people in the United States that are 65 and older are fully vaccinated? What do you think the number is?
Are fully vaccinated?
Yeah.
65%.
Now these are 65 and older.
Oh, 65 and older.
So population 65 and older.
I would say about 85%.
99.9.
99.9. Okay. So it was up there. Yeah.
So this is without mandates, pretty much. I mean, to me,
I think the seniors got the message. They needed to get it for their protection. They saw their friends in their adult communities and whatever being transported out with their ambulances, and they got the message. We need to protect ourselves. This is a virus that was designed to attack them directly, and they got the message, and they're protecting themselves. That's great.
Yeah. So the negative new variant, variants, you're going to have variant after variant after variant. I see the stock market today, tanked a little bit. My buddy is asking me, variants happen with viruses. And, they say, well, what are you, an expert, Dr. Kachmar? Listen, I'm not a virologist or anything. I'm a human being. I read the same, I stayed at the Holiday Inn. So this is opinion shows for everybody to throw it out there, but you don't have to be, in other words, and I have this argument. We're going to talk about this. People say, well, wait. I'm citing the CDC. I'm interpreting their information. Now you could say, Kachmar, you're not an expert. That doesn't mean anything. I'm not an expert. I have a hard time, what I'm going to wear in the morning. Right. But what I am is I'm reading this information here and I'm interpreting it.
Yeah.
Now you could argue and say, Kachmar, you're not interpreting the statistics appropriately. Okay. That's different. Okay. That's a different animal. So you could say that. But my point is that I had a conversation with a guy today in the gym, and we were talking. He goes, why don't people just listen to the experts? Why don't they just listen? We listen to and we trust people. We drive down the parkway and there's somebody next to you. Why don't we just trust?
Why don't we trust the experts?
Well, I can tell you why we don't, because, for the past 4 or 5 years, I watch the news and I listen to what they say, and it doesn't jive with my world.
Right.
And I'll give you, for instance, I used to watch Adam Schiff come out of these meetings and say, I have definitely information that personally, the information that Trump to become president of the United States. And then it all turns to be bullshit. I've listened to, and it's not just, these people on the radio, the View, and even on both sides, in both sides too. I watch Fox News. I mean, everybody's bullshitting. I mean, they're going to lock Hillary up. She's going to be locked up, or they're going to lock Trump up, or they're going to, my point is
too many people are wearing horse blinders.
Yeah. Well,
that's the thing.
But my point about asking me why I don't trust what the experts say. All right, let's talk about one expert, Dr. Fauci. I have a video. We have video clips. Where he said, this back in January, February, when it started with people talking about this, he said, "Oh, there's nothing here. It's no big deal. You don't have to worry about it."
Yeah.
I mean, who said that? He's an expert. Well, he was wrong. Now, I didn't say he lied, but he was freaking wrong. The other thing he said, don't wear masks. Now, then he said 2 masks.
But he also said right at the beginning, there's no way we're going to put up a mandate to make everybody get the vaccine.
Right.
We couldn't possibly do that.
Right. And so
like he was so flabbergasted by the actual question.
Right.
At that point.
Listen, he's a politician and he's a human being. We all make mistakes. The guy was using the analogy. He goes, if you're driving up the Parkway, you trust everybody on each side of you. So why don't you trust these experts? We trust people all the time. Well, I can tell you right now, I trust them, but I don't trust them. I have, cars that I have things, I have cameras, I have lights up because I don't trust people. And every day there's people killed on our roadways because somebody screwed up. I was talking to my buddy on the phone. He was on, hands-free phone, and he was passing a truck and a tire blew out.
Right.
I heard a noise, but he didn't get hurt or anything. So my point is that, why don't I trust? Who do I trust? That's the problem in this country. Yeah. People are afraid. They don't believe what they're being told. And this is a part of our media. Yeah. And I can tell you, left and right, but I think the left has even a more of a thing. So anyway, I'm following the CDC, and I'm assuming that the CDC is not corrupt, that they're accurate. But I'm going to give you an article here. I'll let you say before. So I'm going to cite, and this is about this controversy of infection-induced and vaccine-induced immunity, because this is the big thing right now. I had Corona. Do I have to get the vaccine? Forget about if you're a kid. To me, and that's what Ron Paul was talking about. You don't need it. So what were you going to say, Jeremy?
Well, we were talking about Dr. Fauci, and we were also talking about some good books everybody should check out. The next book I'm reading is written by Robert F. Kennedy Jr.
Oh, no, I thought you were going to read the other one. Are unicorns real? and how much chocolate can you eat before you get a pimple on your nose? Yeah. I thought that was what you were reading. No.
with my fluffy bear rainbow sword. Yeah.
So now you're going into some heavy duty stuff.
No. The Robert F. Kennedy. He wrote a book called Beyond Biden, but his recent book is called The Real Anthony Fauci: Bill Gates, Big Pharma, and the Global War on Democracy and Public Health. Yeah, that one.
That's a heavy. Yeah,
I'm very excited about it.
You could, when you read it, you come in here and you can say,
I'll do a book review on the show.
I'm more interested in Pino Navarro because he was secondhand man with Trump. But as far as, I'm not as much a conspiracy individual as I think that there's 2 things that motivate people, maybe 3. One is definitely money, greed. Mm-hmm. Okay, money.
Money begets lies. Lies beget conspiracy.
And I've seen people who, they got millions and millions, and they still will, beat up people for another penny.
Yeah.
I also see, I want to say, and it goes hand with that is corruption and ineptitude. Okay, mm-hmm. So there's a lot of people who mean well, but they're idiots. Yeah. They shouldn't be in the position they're in. They're over their head. And when the shit hits the fan, they walk away or they're taken out of the situation. That's what I see. And, and then you get this politics getting involved, which is a whole different animal. People who don't know politics, like some people have never been in politics. We use that word, we throw it around. You have the right and the wrong. I used to, when, like my sister was in the military, you used to say, well, you got right and wrong, and then you got the military. Politics is a different animal. People put on a politician hat. I hear that.
Well, see, that's what that you're saying. You're saying you started off saying, natural immunity from.
Okay, we're going to talk about another article.
All right, but you started talking about natural immunity from COVID if you've already had it.
Right.
Okay.
Right.
And the problem is it makes perfect sense. It seems like common sense that I don't need the vaccine if I've got those antibodies. But where common sense stops, politics begin.
Right. Well, so that's what I'm saying. Listen to this article I'm going to read you. This is from the CDC. When you listen to this, you're going to be like, what? This is just now, this just came out. Because I got to contain myself. So this was put out. This was a CDC. People could go and look it up in an article. It's updated date. It's update October 29th, 2021. Science Brief. It says SARS-CoV-2 infection-induced and vaccine-induced immunity. Okay?
Right.
People go, this is a CDC article. All right. I'm just going to blow down here to where, and it's a big article.
Right.
Talks about initial immune response to vaccines, correlations of immune response metrics to protection, immune response protection, on and on and on. And let me just get down here, duration and comparison. Here's the interesting thing. So here's one. So this is down, says comparison of infections and vaccine. So comparison of infection, vaccine-induced immunity responses. Okay. So there was a systemic review and meta-analysis, including data from three vaccine efficiency trials and 4 observational studies, U.S., Israel, and United Kingdom. Now, listen, this is, found no significant difference in the overall level of protection provided by infection as compared with protection provided by vaccine. These included studies from both prior to and during the period of Delta variant. In this review, the randomized controlled trials appeared to show higher protection from, listen to this, mRNA vaccines, whereas the observed studies appeared to show protection to the higher following infection. Let me repeat that. So you have these studies. One is trials, effective trials, and the other one's observation. So it's 2 different studies. But basically, one study said the messenger RNA is better. The other one said the infection is better. So it's a drawer. This is CDC. It's a drawer. Okay. Okay. Now you go down here, a more recent analysis of data from a network of 187 hospitals in the United States found, now listen to me, this is the CDC. This is really important. Among more than 7,000 COVID-like illnesses. Why do they say that? You see how they bullshit? Yeah. Now, I'm not saying the corruption, but not saying the bullshit, but you have to understand when they say that, that means like illnesses. That means they don't know that all those people, okay, but listen, whose prior infection or vaccine occurred 90, blah, 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 blah. There was a 5.5 higher odds of laboratory confirmed COVID among previously infected patients than among fully vaccinated. This study includes data, studies and review, though the author noted one limitation of the design was the potential of missing testing. No shit. So you don't know. So a lot of those people may not have had COVID.
Right.
So that study's total bullshit. You see? So then you go down here and this is so here's another one here at the end. This was a study in December, Delta, based on results that included in 27,000 PCR positive tests. They found fully vaccinated to provide the greatest protection during the alpha predominance, blah, blah, but equal protection from fully. So it says, but equivalent protection from fully vaccinated and infection during the Delta period. So it was a low risk. So I'm just read this. I know you're getting bored with this, but let me just finish up here because I don't want to get too crazy. So here's another one. More recent observational cohort studies, including 700,000 healthcare system users in Israel and over 11,000 healthcare workers in India, reported that the history of prior infection provided greater protection from subsequent infection than vaccine alone. But overall risk of infection was lowest among those that were vaccinated following infection during the periods.
So what does that mean?
So what that means is this, just so you know. Okay, here's and then there's limitations and there's conclusions. Okay, here's and the conclusion right here is basically, this is the conclusion. Doesn't look like there's too much evidence to say that you got more immunity if you had the infection or you get the vaccine. That says a lot about the vaccine, how good it is. Okay, that's number one. I just want to throw it out. I mean, the vaccine's it works. No doubt about it, works. But what they're saying here is that if the vaccine if you had corona
and natural,
you're about the same.
Corona.
But if you had the natural corona, illness and you get a vaccine, you're better than both of those. You understand? So, if you understand now, is that, are you any better off? Is it necessary? You got to remember too, you got to take this with a grain of salt in that, both people's immunity weans. We don't know. There's no way. Well, one thing that I want to throw out here, and this is very important here. It says right now, at this time, there is no FDA authorized or approved test that providers or the public can use to reliably determine whether a person is protected from the infection. So we're just talking bullshit here.
Right.
We don't know. We can't test it. So I mean, it's observational. It's see, when you look at statistics. So basically, what I'm saying here is that if you had the virus, you probably got the same protection as the vaccine.
Right.
Now, if you want to up the game, then get a booster or get a shot. You definitely got more. There's evidence to show that you get more protection. Okay. You know what I'm saying, Jeremy? You get more protection. But how much more do you need? And is it worth the risk of the vaccine? Now, out of all these millions of vaccines, they said about 14,000 people died, but the FDA looked at every one of them and said there's no cause or effect. Right. So I have to believe that. So let's just say, but we don't know what the long term.
The flip side is to this. Okay. So we've just talked about how the vaccine is very good, okay, and with
it works, man.
With the booster on top of it,
it's real. Yeah, it's great. It's real good.
Okay, then you've got.
But what were you going to say?
People like Jen Psaki,
what about her?
She has to have had both shots and the booster, and yet she still got COVID.
Well, yeah, you can still get it. Yeah, sure.
See?
Sure.
I mean, but
what's your point, though? What's your point there? What's your point there, genius? What's your point?
My point is that
what does that mean?
She's surrounded by other people that are following the same mandate, right? So they're all heavily vaccinated and boosted, and she hangs out with all of these people. She is so verbal about the importance of it. These people don't hang out with other people who haven't gotten it.
Here's the way I look at it.
And yet she still did.
Right. Listen, that's why,
which is what really unnerves and confuses the public.
Right.
When they're trying to sell the idea of the vaccine and the booster. And that's where your arguments come from, where it's my right to my body, because people get confused. If you've got the booster and you've got the 2 shots and you're still easily, as far as Jen Psaki goes, easily getting COVID.
I don't think it's easy. I think no. Well, let's get to try to. We want to tell people out there what our opinion is, and what
I'm not as being like protective of myself as someone like Jen Psaki has been. I go out with friends. I don't wear the mask amongst my friends, and yet here she is. She's following all the mandates, all the. Well,
you don't know that. You don't follow her around, do you?
No, but I said she must though. If she's
don't say you must.
If she's the speaker for Biden, okay. Yeah. If she's touting this stuff and she was still able to do it, she's supposed to be the exception the rule. The example.
Listen, during the corona, Nancy Pelosi went and got her hair done without a mask. So I mean, I don't know what you're talking about.
Oh, well, see, there you go.
Gavin Newsom,
there you go.
I mean, they all, they tell it. It's like, do what I say, don't do what I do.
But even if she goes and gets the haircut and she's around people that might have COVID, whether it's the people cutting her hair or the people coming in to get it cut.
Right.
She's got the 3, the vaccines and the booster, and she still got it real quick. And
here's what you got to think about.
Where's the protection?
No. Listen.
Where's the protection?
Listen, you got to go back to the science and look at the CDC. What I just said. There's definitely protection. If you're not we just talked about having corona versus vaccine. We didn't mention about not having it. Now, if you didn't have corona and you didn't have the vaccine, you're flying out in the wind. You're at risk. I don't care what anybody says. You're at risk. Here's I'm just what I'm trying to say. That's not the argument. It shouldn't be. That's politics. The discussion should be, first of all, should we mandate vaccines? My opinion is no, because it's not that the science is not that guaranteed. And like people say, well, why you listen to authorities everywhere else? The authorities don't know right now, and the authorities have been wrong.
That's my point, Mike. You're talking about the bigger people, the people that are making the decisions. I'm talking about public opinion.
Well, that's what I'm talking about too.
When they're seeing it, that's where the confusion comes.
Right.
That's where all that problem comes.
Right. But so having said that, I'm trying to understand where you're coming from. But what I'm telling people out there is this: is that, like, say, the last group of people, there's holdouts. They're 40 years old, they're 50 years old, they're 60, they don't want to get the vaccine. You know what? As far as I'm concerned, fine, don't get it. You make your decision. You die, you die. You don't die, you don't die. I could care less. We got to get back to normalcy. This thing is too.
My father-in-law, Vietnam vet, right?
Mm-hmm.
He's gotten both the vaccines, and he's gotten the booster.
Mm-hmm.
Okay, he's 80 years old.
Right.
All right. See, these guys, I think you could take it, or you can lose, or
yeah, but that's not what I'm talking. Yeah, but you missed. I want to make a point here because you're not getting it.
Go ahead.
My point is that I just point out the science is almost, it's not one is better than the other. All right, if you had the vaccine, great. If you had the coronavirus, you may not need the vaccine. Right. You could get better for sure, but it's not where you should be mandating it, that it's that guaranteed. The next step is with the kids. The vast majority of people who are, a lot of these people who are not vaccinated are the children. They're very, very young, which they want to give vaccines. Now, what I'm saying, if you look at the CDC, you could go on there and look at all the doctors who eventually recommended that the children get vaccinated. The way I read it, and again, I could be challenged. People could comment on our thing here, but what I see is, put our thing up there, Jeremy. What I see,
there's nothing.
What I see is our email address. What I see is that they're saying it's the lesser of two evils. I want to make this point because this is where public, everybody's getting confused. Forget about the politicians. Forget about everything. What's the science? You look at the CDC. The doctors are saying, listen, we think is less risk of getting the vaccine than there is of getting corona. Mm-hmm. And it's not just the risk of dying from corona. There could be long-term sequelae, but there could be long-term sequelae of the vaccine. Yeah. People have to understand, we don't know. They don't know. It's not like they're saying it's guaranteed safe as all hell. They're saying, we believe, we're fathers and mothers, and we're going to give our kids. It's a risk. We understand that, but we think that it's a less risk to get the vaccine than it is to not get the vaccine. Okay, just right. They're saying right now, we think it's better. The FDA and the CDC is saying, I think it's better that you get, if you had the corona, get the vaccine because it even gives you more protection. Right. Okay, is it necessary and is it worth the risk? I'm saying is, everything in life we do is risk versus benefit. Risk versus benefit. You know what I'm saying? And right now, I think the Bens are making a big mistake. Not only the politicians, but the people on the boards, on the school boards, because ultimately, who's making the decision locally is the school boards, moms and dads, and brothers and sisters. And they're saying mandate or not mandate. And what I'm trying to throw out there to people is, listen, to mandate a vaccine for the children with the amount of science it is right now, I think is not appropriate. I'd rather have what I'm saying is, let the parents make the decision. Go, instead of having a school board meeting where everybody's yelling and screaming, say to the parents, here's what we're going to do. You get vaccinated if you want, but we're going to have a 2-hour seminar and we're going to go through the CDC, the information, have experts in here, and we're going to give you what the data is, and then you can interpret it. Now, that's where we're at. But the problem is we're not there. What we're doing is yelling and screaming, craziness.
Yeah. And I think even with the both of us, I think we're arguing the same point from two different directions. Okay. I agree 100% with what you're saying. 100% I agree. But when you introduce mandate and then mandate becomes a battle with choice, It doesn't matter what the science says. It gets all cloudy and muddled.
So the representative, the woman you're talking about, who I never watched. I never watched her. I haven't. I don't.
Oh, I can't stand.
Well, it has nothing to do with that. I don't have the time, and I mean, I get little tidbits, but you're more on the political arena. So, but what was your point? Like, what? So she had the vaccine, then she got corona.
They're the ones that are enforcing the mandate. Okay.
Right.
So in the public's eye, they are the golden standard as far as their point of view goes. Okay.
Yeah.
So if they're mandating the vaccine, and then the booster, and now you got to get all three if you're fully vaccinated,
right,
then somebody like Jen Psaki should not have gotten it so easily. I mean, that's ridiculous.
Oh, you mean she shouldn't have got sick?
She shouldn't have got sick so easily. If this is supposed to give you all the protection that you can get, how does she get?
Well, I could tell you, because here's the thing, Jeremy. She was wrong. Simple as that. Obviously, she was wrong. In other words, if you tell me I'm buying a parrot, it's the Monty Python, and I get the parrot home, it's dead. They like open up the box. You sold me a dead parrot. I mean, you could. So he brings it back, and he's like, "Oh, that parrot's not dead." He goes, "It's dead. It's hard. It doesn't breathe. It doesn't talk." And he goes, "Oh, no. Yeah, the parrot's not dead." Well,
she's bereft of life.
So she could sit there. I don't know what she's saying, but she could sit there and say, no, obviously, that's why I'm telling you, the vaccine is not 100%. It's not. Now, is it 90? Is it 30? Is it 40? You could look at the statistics. You could test people. And that's another thing. The testing is, how do you know? Here's the thing. How do you know somebody's got the coronavirus? They get sick, right? And you test them. I've had people in the hospital tested 2-3 times, they were negative. And then the 4th time or 5th time, they're positive. I have people who were tested positive and they didn't have one symptom at all. They never had any symptoms. And then they tested again, they were negative. Was it a false positive? You got to understand, we're fighting over, I don't want to say crumbs, but we're fighting over shadows. We're fighting over, breezes. We don't know, Jeremy. So she was wrong. You say, oh, how effective? How many people right now are getting breakthrough infections? So you could say, well, it's the variant. You could say it's the weaning down. We need to get another, a booster. Here's what I like for the federal government to work on: therapeutics. But I want to make sure. I want to know right now. Jen Psaki or Biden, do you have enough monoclonal antibodies for everybody who needs them in the United States? Do you understand the FDA? This is not hocus pocus. The FDA is approved. Right now, anybody out there listening, if you get sick with corona, whether or not you had the vaccine or not, whether or not you had the coronavirus or not, you get sick with corona, you should be trying as hard as you can to get infused with monoclonal antibodies. The CDC, the FDA, 75 to 85% reduction in hospitalizations and deaths. I
understand that.
And people have died who've had the vaccine and got corona again. So I'm not going to argue how effective it is. It doesn't matter to me now. What matters is you got to approach this multiple ways. But here's the thing. The last thing we got to stop doing is closing down the friggin' country. Now, you talk about mask mandates and vaccine mandates. If the people are educated, like the old people, right? People 65 and 99.99999 got the vaccine. These people are not stupid. They got it. The parents, if they feel comfortable and they get educated and the science is there, if it is there, they're not. You don't have to make them get the vaccine. I'll go back let's talk about what's happening with the surgery center that you work at.
Okay.
Let's just talk about what the mandates, how many people are going to be hurt. Tell me what's happening with the mandates, because this will make a point.
Now the government is working through Medicare, okay? And Medicare is now threatening...
Stop for a second. So people have to understand, Medicare regulates, if you treat a Medicare patient, they regulate your facility. How big the bathroom's got to be, how many employees you have, how you sterilize equipment. So go ahead, Jeremy.
Before they even pay you.
Right. Yeah. So get it. So they manage.
These little things need to be clicked into place, and then Medicare will dish out the payments accordingly.
So if you own a surgery center, keep going.
So with the Biden push to get absolutely every single person in this country vaccinated, they are reaching out to all of these businesses. This is nothing new for most of you out there who have gotten threatened with your livelihoods and all of that if you don't get vaccinated right away. Well, now Medicare is threatening the surgery centers, and they're saying that if your staff in the surgery center are not fully vaccinated, we're going to be withholding the funds that are earned to you and all of that. And now the line is now a lot of these surgery centers, they weren't ready to threaten their workers like these other businesses, because they didn't have to. Now they're desperate to stay open if their staff doesn't. And so now we're losing good nurses, possibly, and all of that. And a lot of these places, a lot of these people, we're talking hospitals too, and all of that. And it's all with the nurses and stuff. These are people that were on the front line from the start.
Yeah.
Okay.
Yeah.
These were frontline fighters against this vaccine.
Right.
They were seeing the bodies come in, and they were working as hard as they could to make sure they didn't go out to the funeral homes. And now we're tossing them out onto the street just because.
Listen, right.
They don't want to.
So, and here's how I feel about that. I go by what I see personally. That's why when people ask me, why don't you trust the experts? Because I personally watch what the experts say, and it was bullshit, and it would turn out to be a lie. And the next day say something else. So that's me looking at it. Yeah. So two nurses I know, I told the story a million times. In July, August, two nurses who worked in the hospital, one of the hospitals I'm at. They were both pregnant at that time. They worked the whole time during Corona. Mm-hmm. They were on the floors. They took care of people. Hundreds of people who had Corona. People died in holding their hands. They were exposed to it. One girl got the Corona. The other girl, who knows? She never got it. Maybe she got it. I don't know if she tested negative for the antibodies. And the other girl, I think, had antibodies. She tested negative, but maybe she's immune to it. There's people who might be immune to this thing. They may not get it. Yeah. I'm telling you. So we don't know that yet. So because that's what AIDS. There's a certain amount of population will not get AIDS. Their T cells won't accept the virus. No. Anyway, so both of them are pregnant, and the hospital says, "Listen, by October you got to get the vaccine, or you can't work here." They won't even give them you could test, none of that. You're out of here. Yeah. But see, that's another. Some companies are saying, okay, you could test every week and all that. So they're like, listen, we work with these people. We'll continue to work until we'll wear masks, until we go out on our disability for pregnancy. They were cool with it. They want to take the chance. They'd rather take the chance getting exposed to Corona as opposed to getting the vaccine. The one girl had Corona already, and the other girl, didn't. Now the pediatricians and the OBGYN, we're saying it's safe. CDC says it's safe for pregnant women. I just want to throw that out there. Now, again, how safe is it? And, I think, again, their opinion with this is it's probably safer for the vaccine than if you get Corona. Yeah. You understand? Yeah. But, there's the perception there that another way to look at that is, well, you don't know if you're going to get Corona, but if you get the vaccine, you got the vaccine. That's 100%, you got it. If you don't get the vaccine, you take a risk on the Corona, you may not get it. I don't know what your odds are, 50-50. So my point is that both those nurses walked. They're out. They're fired, whatever you want to say. So we don't have them there. They were tip of the spear, the best. Now, I mean, what did we get out of requiring them to do it? There are people now. You go back and you look at the statistics. There is an uptick of people getting the vaccine because they didn't want to lose their job. Right. So it does work, I mean, so getting back to the thing,
I want to get this out because this is the big picture that I'm seeing. Okay. So all over the spectrum now we're seeing businesses, and they're forced to fire their employees because they're not fully vaccinated and all that. And in hospitals, oh my God. I know a few nurses that are feeling so adamant about it too, that they're not getting the vaccine. They've already gotten COVID. They've got the antibodies, and usually in a lot of these places, not only are they getting tested twice a week, just to be safe, they've got those antibodies. Okay, the big problem is here with the ones that are walking. Where are all of these now unemployed people going to go? The unemployment rate is going to rise to such a high level in this country. They think they can just leave and go find another place and it'll be okay. But with so many people walking or getting fired, there won't be any place for them all.
Listen,
nowhere.
One of the patients, the wound care centers can't accommodate the patients because they don't have enough nurses.
But do you see the number of
I don't know. I haven't looked.
Rise?
Here's the thing. I don't know. I haven't looked at the unemployment numbers.
Yeah.
But I can tell you right now, I know one thing. I see it in my world because I don't look at unemployment, but I see in my world, there's not enough doctors, nurses. There's not enough people to fill the gaps. It's becoming very difficult. They're leaving.
The medical field is only one small
What,
area. I'm talking about across the board.
Right. Yeah. They're going to mandate, again, it's on hold. These
people aren't going to be able to find work like they think they're going to.
No. Well, that's a side issue. The issue here is
that's not. You know what? No, there's no side issues with this stuff.
That's why they leaving?
It's all a chain reaction.
I understand, but it starts from mandates. You understand?
Yes, I 100% agree.
After that, whatever happens after that, I can tell you right now.
So you were talking earlier about the science, and I fully agreed with you 100,000%. If it was just science, and this is before all the mandate bullshit, right? If it was just science. Oh man, I 100% agree with you, Mike.
Right.
I think.
So what's the solution? What's the solution? What's the solution to all of this? Stop the mandates.
Stop the mandates.
Right. That's not going to. Here's the thing, though.
And when do they stop doing it? If it was emergency powers allowed to them to be able to do the mandates, that can be taken back after a certain amount of time. When do we take back the mandates?
What I'm trying to say to people out there is that it's not going to matter if there's mandates or not. You made a good point about Jen Psaki. Let's just say the whole country gets inoculated. You're still going to have corona cases. I hate to tell you. You're still going to have people die. I hate to tell you. You're still going to have variants. I hate to tell you.
Yeah.
It's going to happen.
With or without mandates.
So what you're going to do is, to a certain degree, all these lockdowns and everything are prolonging the inevitable. The whole idea was to slow the spread down initially. Yeah. Okay. Slow the spread down. And then until we get a vaccine, until we get therapeutics. Hey, we have them. We have them. The horse is dead. The parrot's dead. Stop beating the friggin' horse. What you need to do is open up the country.
The parrot's not dead. He's just molting.
Masks and vaccine mandates. Forget about that. I think it's good policy. Say, listen, we, at the school board, instead of I'm trying to give people out there an alternative. Instead of, Psaki should sit there and say, listen, we believe that this stuff works. We think that, you should get vaccinated. If you didn't get vaccinated and you get corona, we want to make sure that you get monoclonal antibodies within a few days. We want to set that up. We want to make sure there's enough out there. We don't want to play politics with it. We're going to look at all other alternatives, maybe ivermectin, whatever else. Joe Rogan took that on and on. Therapeutics, if say a kid's sick, don't let him go to school. Targeted, boosters for old people.
All these other medications that we're mentioning and we're bringing up, though, are medications that do not fit into the government mandate.
Well, it
would be great. And this is where I said earlier about what you said about all the science and all the common sense.
Well, that's the politics.
If that were the case, that you could have the freedom to go and take the monoclonal antibodies and the ivermectin, then everything would be okay.
Right.
Because we'd have that choice to be able to do these things. But with mandate removes choice, and that's just a pipe dream right now.
Right now, you have a variant in South Africa. So I just saw the government is stopping all travel from South Africa. Because when Trump did it, it was like, oh my God. So, again, the politics with the monoclonal antibodies. You could get monoclonal antibodies anywhere, anybody could have gotten it, any state, any doctor, any clinic. Well, the Biden administration took it over and nationalized it, and they basically said who gets it and who didn't get it. Now, their argument was there wasn't enough of it, and we had to ration it. Now, I don't know. I haven't been following it because it's hard to find, but did they beef up? Have they, ratcheted up the production of monoclonal antibodies, which the CDC says works 75 to 80%. So even if you didn't have the vaccine and you get these cases, say right now there's a surge, who gives a shit if there's a surge if you have a way to treat it?
Yeah.
I mean, I gives a shit. I would care. I mean, but if you tell me you get a 40-year-old who didn't have the vaccine or corona, and you bring him over to the hospital and get him infused with monoclonal antibodies, you reduce their death rate and hospitalization by 75 to 85%. Well, there you go. How much does it cost? I don't know. Now they're coming out with a pill. So my point is that you contrast that, Jeremy, to these nurses not working, people not getting care, to your labor force is out, you're not getting stuff delivered. It goes on and on and on. Which is the lesser two evils there? Because it's all choice.
Now we're talking a giant goddamn mess,
right? So
someone needs to dig us out of it,
right? Well, the thing is, to me, is I want to throw these things out. They're not following their own damn science. Now I'll give you another one. I don't watch NBC, CBS. I don't watch cable TV because it's a bunch of horse shit.
I don't watch that shit.
It's a bunch of horse shit. I mean, I'm telling you, those people live in, I don't know, a fairyland, but crazy, like Alice in Wonderland. But I'm watching the Macy's Day Parade. Did you watch it?
No.
Everybody in the parade.
I'm not going to watch the parade until it's normal again.
Listen, everybody in the parade.
Yeah.
I didn't watch the whole thing because I was, with dinner and everything. Everybody had a mask on. They're outside and they got a mask on. Yeah. What? For what?
This was the only way they were going to be allowed to stand out.
Why? How? What? Show me what science? I can see if you're inside. I can see wearing the mask if you got a cold or corona. Yeah. But what? They're out there
because Macy's doesn't want the liability of everybody catching COVID while they're watching the parade.
Okay, so if you wear the mask and you catch corona, is there any liability?
Well, yeah. I mean, I don't know. That's a great question.
And besides that, how are you going to prove it?
That is a great question.
I mean, my point, it's crazy. So the CDC. I mean, you could write. You go in there and you could read a whole thing about masks. That's another whole thing.
Yeah.
My point I'm getting is that if you look at the science is not guaranteed. I have arguments where people say, "Oh my God, it's the safest thing, the best drug." No, it's not. And if hopefully there won't be any side effects going long term, but But here's the thing.
Great, hopefully.
But let's just say that we don't know that. You won't know it until 2-3 years down the road.
Sure.
But what I do know right now is that people who are fully vaccinated still get corona and they still die. Now, is it a large percentage? No, and that's what has to be. That's what you have to say on both sides of the aisle. It works. I got the vaccine and I had antibodies. I didn't have it before that. It works. It reduces your exposure, it reduces your deaths. So we know it works.
So
but
here's a question.
But why mandate something? Here, hold that thought. The question: why mandate something, Jeremy? That the science, it's like one hair one way or the other.
Right.
I just cited a whole bunch of studies.
Yeah, no, you're right.
I mean, if you say to me, if the government says,
right.
hey, listen, everybody out there who had coronavirus, you know what? We recommend the vaccine because you'll be better off.
Yeah.
But don't mandate it because you're just as good as somebody who had the vaccine.
Mandate it.
Right. So what were you going to say? What was your point?
No, my point is that it's you're right. You're 100% right. And but then why the mandates? You just said it.
Now listen, if I was the president of the United States, and I would do this. If you really want to do it, Biden, listen, if you don't get the vaccine, firing squad.
Right.
Like they did in Nazi Germany. You don't want to sign the papers? You don't want to, or no, better yet, how about we get a giant stadium? Just like what they did with the Catholics. If you don't want to denounce Jesus Christ, put the lions in there.
Or internment camps like they did in 1942.
Well, that's
with Japanese Americans.
That wasn't. They didn't ask them to do. They were worried about they were going to be, spies and stuff.
Right.
But my point is that listen, if you really want to do it, then just take these people out and kill them. I mean, it's
you take a step back far enough. I mean, what's the difference between people, armed people that could be spies and a virus that's spreading about from people to people?
Well,
it's all harm. It's all harm.
Well, it's about government overreach. Here's the thing. Going back, you got to step away from here. When the president of the United States, which was Trump at the time, he declared a state of emergency, and then the states did that. And that's the executive branch. The state of New Jersey is a great model for this. State of New Jersey, when Corona hit, the governor declared a medical and state of emergency, which gave him sweeping powers. And one of the things he did is, if you remember, everybody's concerned about the hospital's going to be overrun. We're not going to have enough room. People are going to die. So they decided that they were going to send these nursing home patients back to the nursing home, because nursing homes are kind of like quasi hospitals. Mm-hmm. But they knew from the studies that came out from Taiwan and Hong Kong and where the first SARS was, that beginning, that affect old people, especially in China. Yeah. So Cuomo and Murphy sent these people back to nursing home and friggin' decimate. I think 11,000 people died in nursing homes in New Jersey. And they could have sent them, you could have kept them in a hospital. They could have sent them to the ship. We talked about this. They could have sent them to, the Marine, there was a big military.
But at the same time, there was also some treatments that they could have given those people and didn't.
Well, I don't know. It was right then and there. Yeah, but I think it was kind of soon. But here's the thing. Having said that,
I remembered what I was going to say.
Yeah. What I was saying is that the power, and that was the executive orders to, the nursing homes had to accept them, the hospitals had to give them. And I'm not saying that, they did it, there was conspiracy or was politics involved. Some people have said that. And there was a study. Murphy had a $5 million study, not this July, last July, that the state of New Jersey paid for, the taxpayers paid for, to evaluate what happened in nursing homes. And, pretty much it was, the staff was inadequate or unable to handle the volume, So, and I think, to me, that's disingenuous. But getting back to the thing, you have to look at what happened here, and you have an abuse of power. You still have it. Biden, it's still under this emergency pandemic.
That's
right. So they could do what they want. And there's some states that actually pass laws where the executive branch does not have the power to do what they did in New Jersey and other places. And to me, I think 10 years from now, we're going to go back and look at this and say, what the hell went on? It was an abusement of the executive branch. A lot of places.
You're going to see that in more states in the aftermath.
Well, states are fine
because they're going to prepare. They're going to prepare for the unknown in the future, and this ever happening again.
Well, I think what's going to happen is that a lot of states legislature they're going to say no. The executive branch. Here's what I would say. It would have been nice.
It's
I think
already starting to happen.
I mean, in New Jersey, maybe the governor has to, if there's a state of emergency, he or she has to talk to the legislative, the judicial branch. Maybe the legislation has to be called in and they vote on it. How about that? I don't mean for closing the parkway in a storm, but something of monumental where people's lives, big time lives, long term, where you could sit down. There's no, a northeaster storm's approaching in February. You got to get a foot of snow on the parkway. You can't get the legislatures together. But why? But this thing with Corona, they could have. Now, maybe they did. I don't see that. I might be wrong, but my point is that, like Biden right now, the mandates that they're putting out, I think are I don't know if it's the will of the people. And then forget about that. Go back down to the level of the school boards, and so, what were we going to say? What was your point?
This was my big point.
Yeah. What was your big point?
So we were talking about all these smart scientists and big people. Then we mentioned Jen Psaki and how she got it with both vaccines and the booster.
She had the booster, huh? Yeah, she did.
I mean, she's touting it out to the reporters.
And then she still got. She confirmed. How sick was she?
I don't. Well, she was out for the quarantine time anyway, and they had her assistant or something.
Did she definitely have it, or she just tested positive?
No. She
was coughing up sick and everything.
She had it. So my point is though.
What's your point?
If you can still get it, and we've established that you can. If you can still get it with both vaccines and the booster, why aren't they working on something else that can be better than what we've got? Why are we just going through the same vaccine and just adding a little bit more to it and a little bit more to it and a little bit more to it, like the boosters?
As opposed to what, Jeremy? I don't get what you're saying.
Initially they said, if you get the 2 booster shots, you will be protected. Okay. Now they're saying, well, you're going to need or if you got the 2 vaccines, you're going to be protected. Now they're saying if you get the booster along with those 2, then you'll be protected. And now I'm hearing that they're mixing in the booster with flu shots and HIV medicine. So obviously what we've got isn't working if people are dying from it, if they're still getting COVID from it. So what's on the drawing board for next? Nobody is saying it. They don't seem to have a plan for next. They're just adding more and more and more and more to the vaccine we currently have. So that's where I get confused. Like, what are we doing other than this?
You need therapeutics.
I would like I'm a man who needs a plan B, a plan C, a plan.
Well, I would say this. I don't know if this is answering your question. You know, Peter Navarro, if you go back to when they planned this, the Trump administration, when they tackled this, there was no vaccine. They didn't know if they were going to be able to do it. So they had a strategy, which I think was a good strategy. They were going to have the vaccine, which was a new vaccine that came around quick. It was, the messenger RNA. Okay. Right. Now, who knows how long it would last? But it was quick, easy, and new technology. And so also what they did is they closed the country down. You stopped the spread. Then they were working on therapeutics. There was a lot of therapeutics out there: ivermectin, hydrochloroquine, and others. And some are good, some are bad, some are controversial. The one that really works very well is the monoclonal antibodies. But I'm going to tell you, with the monoclonal antibodies, who knows how dangerous that is too, long-term effects. So, we're dealing with a bad organism. Here's the other thing is China hasn't, I don't think to this day, has given us the DNA model for this, the coronavirus, right. The blueprint. And we're trying, I think, to make a vaccine for the coronavirus would probably be the best thing. Okay. But having, say, where do you go from here?
So you're talking about we need the original strain,
Jeremy, here,
and then maybe we can build something better.
I'm going to give you reality. This is reality. This is what it is. This thing is going to rip through this world. We can slow it down. We can modify it, but it ain't going anywhere.
It's not going anywhere. So this is long term.
It's just like the N1, H1, the flu of 1918. It's still around. I mean, it's in our body. It's weaned down. You get mutations. Okay. There's other coronaviruses that are around for regular colds. It's not corona is not a new organism. This is a new corona, but there's other coronaviruses. So what you got to do is you got to manage it. This is what we're talking about. This is where you're getting confused and other people getting confused, and where the argument is. The argument is, how do you manage this coronavirus? It's here. You'd like to get rid of it, but unless you basically exterminate everybody in the earth, now, can you completely cure it? Well, we didn't cure AIDS, but we control it. Okay. The flu every year in the United States, 300-400 kids die. Maybe I forget how many, 80,000-90,000 people die. How many, like hundreds of thousands of people are hospitalized.
How many people died from just the AZT medication for HIV?
Well, I don't know about that, but
I'm saying
there's a risk. People still die in this world from tuberculosis, from AIDS. It goes on and on and on. Yeah. I mean, so I'll give you another thing. From last April 2020 to this April 2021, 100,000 people died of drug overdoses. Okay. And that's now 60, 80, 70 for at least 7-8 years that I could tell you. More people have died from drug overdoses in this country in the past 7-8 years, pretty damn close to how many people died of corona.
That's what I was saying.
What do we, is Kasaki's talking about that shit? So getting back to what you do, here's the bottom line.
Well, before you go further, but that's what I was saying about the HIV, because the drugs, because when do we learn our lesson about these vaccines that are continuing to kill, or they don't quite really work? We need to know that our government is working on alternative means of fixing this problem instead of putting all their eggs in that one vaccine basket.
That's a good point. Now, So, because we're at the end of the show now, so we finally came to consensus. Absolutely right, Jeremy.
Yeah.
What they need to do is what you want to have is a approach like with AIDS. It's not just one medication; it's multiple things, and it's education, and it's all of that. So what's going to happen with Corona is you're going to have the vaccine. And you know, I think a better way is to persuade people with the science and not with the, you know, not with the gun, but with the, you know, I don't know, what would you say? With you know, with the sugar cane, or, you know, not the whip.
More honey, less vinegar.
Yeah. And I think that you do a lot. You cause less fights, less anxiety, less disruption of the workplace. And I think it's a better way to go. You know, the Democrats always talk about,
we got to take the mandates
away
out of their power.
You know, they want to be
that
right,
is nuts,
right,
because
right,
we don't
right.
even have a time limit as to when they can stop doing that.
No,
and is that going to be the new normal?
And
too?
if you look at the seniors, 65 and older, they knew the medicine. The medicine was clear. You got a 25% chance of dying if you're like 65 and older. Look how many people got the injection. There was no 99.9.
Right.
They went to
the thing.
So you don't need mandates.
Those,
you don't. Here's another thing, Jeremy. You don't need.
You don't
mandates.
need them. But the problem is this: it's one thing to mandate the vaccine. Oh, you have to get it. It's another then to extend that mandate to threaten livelihoods, everything else like that. Because that's tearing apart families across the country. That is tearing apart our freedoms and this land that's supposed to have streets that are paved with gold.
Right. There's another thing here, Jeremy. That's another layer here.
You see what I mean?
Yeah.
Though,
Oh,
right?
yeah. But there's another layer of subtlety here, and I want to finish this up with this.
Yeah, go ahead.
And you could see it. You could see it. This is a hard concept to understand, but you could see it with Rittenhouse. The trial, you know, and I've read several articles on it, you know, both sides. But what's interesting, a lot of people believe that he does not have the right to protect himself. Okay, we talked about the Second Amendment. I believe it's God-given right to protect yourself. I also think it's a God-given right that you can make the decision. We're autonomous. You know, that's the difference. Before the founding fathers invented or put together this country, right? You didn't have rights unless you were like a king or a queen or a dictator. You know, you had no rights. How you had rights is what if you had a bigger army, who had the bigger army, who had the more money. You know, basically who had the bigger army, and then you could go in and do what you want to do. So you know, this Rittenhouse, people are writing, he doesn't have the right to defend himself, or he can't go into an area and provoke something. My point is that you have a lot of people in this country say, you know what, bullshit. You don't have the right to say no to a vaccine.
Yeah,
that's another issue that's playing here, Jeremy. It's an underlying. You talk about systemic racism. It's a systemic. You know, I don't say, but the government or whoever. People in general feel that other people, for the benefit of everybody, you know, should line up like the China. You should, you know, if you know, wearing makeup is bad. I have friends who are so to the left that, you know, if they had their way, we'd all wear, you know, gray outfits, no makeup, you know, cut our hair like, you know, like they do in, you know, like the crew cuts,
right.
You know, like, you know what I'm saying? Like, so that's another thing here. And what I'm saying is, listen, we got to stop this horse shit. We got the tools. We don't have to close up. We don't have to mandate. Let's be more touchy-feely. You know, the Democrats talk about being, you know, civilized. Don't force anybody to do anything. You know, I mean, there are certain things, you know, like even, you know, speeding or you know, we don't take our cars and put a thing on where you can't go fast.
Yeah.
You know, but we know speed kills. I was just watching Elon Musk with his Tesla. You know, he's got a car, you press a button, the car accelerates, you know, it's got like from 0 to 60 in like a second, you know, it's like one of the fastest accelerated. Well, that could kill people, but we don't, you know, why do we have that? I could tell you right now, in the future, with, you know, if you want to have all electric cars and you want to have them real small, they ain't going to go that fast. So my point is, listen, we're going to close the show, but Jeremy, how do you like listen, we're going to look at there's our Christmas. That's our can up there for lifeguarding. So anyway, say hello. And Jeremy, this is our other shot here. I want to let's throw up on the thing there, Jeremy. Where for people who are podcast, my name is Dr. Michael Kachmar. I'm a board certified reconstructive foot and ankle surgeon. I operate in many hospitals. My webpage, which is a great place to land, is JerseyShoreFootAndLegCenter.com.
Yes.
And you could go on our YouTube video. This will be archived, and you could look up, you could see it. Also, you want to send us an email for the show. And we will start. We're going to start probably the first of the year doing call-ins on the show, and we'll give you a phone number for that. But in the meantime, you can send us an email, which is Dr. Kachmar. So it's DrKachmar at Comcast.net.
Nope.
Excuse me, Comcast. Excuse me. That's my. I apologize. Thank you, Jeremy. We got so many emails. It's Dr. Kachmar. That's DrKachmar at iCloud.com. iCloud. Right. We have another one, Dr. Kachmar at Comcast.net. That's my office, so you don't need that. This is for the show. It's Dr. Kachmar at iCloud.com. Yeah. Send us an email. We monitor that, and we can maybe get you on the show. And Jeremy, what else you want to say?
Be sure to go to JerseyShoreFootAndLegCenter.com. We've got great vitamins, vitamin D, that'll help you help strengthen you against COVID. You can get all of that from Dr. Kachmar's website. Right. And again, let me just state that we are a video podcast now. We're on YouTube, Facebook, but we're also an audio podcast as well, which you can find on Spotify, iTunes, and a number of other places that provide podcasts. Just type in "Scrubbing Up" and Dr. Michael Kachmar, and you'll find us and you'll get to see us. Tell your friends about our show.
Subscribe.
That means a lot. It really means a lot to us. You'll get.
We got to start putting that up there, Jeremy. Subscribe.
While we're doing it,
hit up.
Because we're a small show. We're trying to grow and make it bigger, and we can only do that with your help.
Help us out.
So, but God bless all of our continued listeners and fans. And as I say every week, and I'll let you close it.
Well,
be kind to each other out there, folks.
Right. And I want to add something, Jeremy, before I forget, is that this is a radio talk show. So this is our opinion. We're no geniuses, and anything we say here, we recommend that you go, talk to your family doctor, your specialist, go to CDC, learn. We're just trying to point you in the direction.
This is where you start, Jeremy? This is where you start your research. It shouldn't be where you finish.
No.
Okay. Our show like this, it's a mixed bag, but treat it as a buffet. You take what you want and you leave the rest. A buffet.
Wow.
You take what you want and you leave the rest. But it should not. Do not say, "Oh, well, Dr. Kachmar told me I can do that." No, we're not saying that. Start your research here, and then go on and learn more.
Yeah, we try to bring common sense. So anyway, Jeremy, I want to say goodbye. It's been great. We're going to get our, you love our music, right, Jeremy?
Oh yeah. Let's play that again.
We're going to get our little
music
here.
Again?
Yeah, we're getting in here. So again, this is Dr. Michael Kachmar. This is our Scrubbing Up with Dr. Michael Kachmar. This is our new music. Anyway, everyone, we'll see you next week. Next Friday.
Take care, guys.
Bye-bye.